If you've not heard of Project 2025, it's a political playbook for what the next Republican administration could look like. If implemented, it would make sizable changes to the lives of service members and veterans. So what exactly is the initiative, and what impact could it have on troops and vets? Project 2025 includes a roughly 900-page policy agenda, a personnel database for those who could serve in the next conservative administration, a training for those individuals, and also plans for a playbook of actions to be taken in the first 180 days of office. Policy proposals in the plan include reducing the number of generals, banning transgender troops from service, and revoking the VA's ability to provide abortion-related care. The project was organized by the conservative think tank, the Heritage Foundation, and the policy guidebook was authored by many officials who served in former President Donald Trump's administration. But while Trump has distanced himself from the Project 2025, Democrats have worked to tie him to it and have called the agenda a, quote, dangerous blueprint for what his second term could look like. In a chapter on the policy plan for the Department of Defense, a former acting Secretary of Defense under Trump suggested a series of policy changes that fall in line with conservative culture war arguments. That included reinstating service members to active duty who were separated for not receiving the COVID-19 vaccine, abolishing diversity, equity, inclusion offices and staffs, and reversing a policy that lets DoD cover travel costs for troops seeking reproductive care, including abortion services. Other propositions in the plan involved less partisan arguments, including reforms to the military's recruiting efforts, shipbuilding plans, and improvements to base housing. Separately, in a chapter dedicated to revisions to the Department of Homeland Security, it suggested that the Coast Guard, which currently operates under DHS during peacetime, be transferred out to the Justice or Defense Department. The policy chapter on reforming Department of Veterans Affairs involves rescinding VA's ability to provide abortion services and revising hybrid and remote work options for the department's employees. It was written by Brooks Tucker, who served as the VA's acting chief of staff in the last year of the Trump administration. The section proposes requiring Veterans Health Administration facilities to increase the number of patients seen each day to equal the number seen by DoD medical facilities. But not everyone, however, agreed with taking that approach, arguing VHA healthcare providers need to spend more time with veterans during their appointments to effectively address their complex health needs. While the Project 2025 guidebook has recently taken the spotlight in the 2024 presidential race, troops and veterans will have to wait until the outcome of the election to determine whether recommendations from the initiative will be carried out.